Well, we're here in Dundee today to kick off the first of the national conversation events about the future of health and care in Scotland. This is the first of many such events that will be held the length and breadth of Scotland to really hear the views of the people of Scotland about the types of health and care services they want to see in the next 5, 10, 15 years. It's been a fantastic session with people from a whole variety of different backgrounds, but all very keen to talk about the new models of care that we need to see going forward and how we might achieve those.
It was a very, very well attended, well spoken about event, and from the subject matter, conversation, there was loads of conversation in the room. CAB Secretary realises how important it is for the health service to go forward, possibly within a changed model of care, and I think that's all important for everyone.
I thought it was a really interesting morning actually. The table I was at was great as well because there was such a mixture of people from different backgrounds, both people that are managing and working in services but also people that are accessing services. And I think that was so good about today actually, is the fact there was such a mix of people and actually hearing from the people that are accessing services themselves, which is the most important thing.
I would like this national conversation to achieve some very different models of care for the delivery of health and social care going forward. If you look at primary care, for example, we need to completely modernise the way primary care is delivered to make sure that we can support more people with their health and care needs in the community rather than them having to necessarily go to the acute services. But we can only do that by completely changing the way primary care is delivered, by utilising all the skills of all those health professionals that are very well trained to use those skills and experience, and to enable the GP to be the clinical expert behind that team, and we can build a community health hub around all of that expertise and make it easier for people to access their health and care within their locality.
So I think taking that sort of wider holistic approach, and again along the conversation of that one-stop shop that's been going on this morning, I think those are the types of approaches that are really useful in supporting people in our local community.